So the future needs radiologists who can use the artificial intelligence.
Yeah, I mean, one big sort of uh, thinking is that we could perhaps use artificial intelligence in an efficient, early, what we call low hanging fruit way, is to, instead of screening mammography, let's say, to say that your negatives, right? And if they're confident in 90% of the cases with, let's say, close to 100% confidence, then those may only need a very quick glance and maybe not at all even by a radiologist. And then let's say the whatever percentage left, let's say 10% for discussion, will be for the interpretation of the radiologist in a more um, deliberate way. So that already is serves as a form of triage that'll be helping with time in areas where, of course, time is very important and talents are very important. So shortages, resource where there are less radiologists or less dedicated in terms of some specialized radiologists, that could be an applicable situation. But aside from detection and say diagnosis of benign versus malignant, you have products that will help with scheduling, products that will help with your packs in terms of how you hang films, whether you have this is an MLO or this is a CC, and left versus the right breast, making sure that's okay. Of course, systems to remind patients that it's time to come back for your follow up. All those
Wow.
artificial intelligence can play a big role. And should we go into the area of personalized screening, which patients may need more intensive screening because of the risks, artificial intelligence, all that can play a role. So, yes, we radiologists traditionally think of benign versus malignant and just finding abnormalities, but of course, many other uses beyond that too. Not, and I personally think that those other uses are just as exciting, if not more exciting.